Pre-1800s there was barber surgery, essentially human butchery, amputating limbs with no kind of anaesthetics or antiseptics. It was painful and badly done, with so many people dying after having an operation that it became dreaded to have one. There were three main problems with barber surgery. The first was the pain people went through during the operations was most of the time unbearable, needing men to hold the patient down. The second was infection, and the fact that even if a surgeon thought the amputation went well, it was very likely the person would die later anyway. Blood loss was the final problem, and the last to be sorted. There were two anaesthetics before the final solution was discovered. Nitrous oxide, or laughing gas, took away the pain as long as you were giving it, although it did leave you awake while the operation was happening. Ether was better in the respect that it knocked you out, although taking the gas for too long would make the patient vomit. Chloroform's properties as an anaesthetic were discovered in 1847 when a man named Joseph Smith was at one of his sniffing parties with friends. It had no negative side effects and also knocked you out. This was the best anaesthetic available at the time, which lasted many years into the future and is still used for many things today. The black period of surgery came around in between the time of chloroform's discovery and carbolic acid, so between anaesthetics and antiseptics. From 1847 to 1867, doctors became leisurely when someone was cut open and allowed infection to destroy people from the inside. Antiseptics were first invented in 1867 after germ theory that started with carbolic acid. A man named Joseph Lister observed how it was put on sewage to get rid of the smell and decided to use it in operations as an experiment. People would come into the theatre in their normal clothes and would get sprayed down with the acid. This would continue through the whole operation, so everything stayed germ-free. The movement from antiseptics to aseptics meant that instead of being dirty and spraying everything to make it clean, the operating theatre started with no germs in there that could cause infection. William Halsted was keen to use this because the carbolic acid was harming his wife's hands. After World War II, early plastic surgery was introduced by Archibald McIndoe to help pilots who had been injured by burns when their planes went down. Skin was taken and grown from the back of their necks to their faces, which is called a skin graft. It was around this time that blood groups were discovered also, making transfusions much easier. Heart surgery was a huge challenge to overcome. You could have 3 minutes at most on the heart before the whole body stopped functioning, until Bill Bigelow discovered that if you kept the body cold, slowing down the functions, you could have an extra few vital minutes on heart surgery. The first heart transplant was performed by Christian Barnard in 1967, and he became a public celebrity because of it, although there were still problems with the body rejecting the new heart. The solution came with the drug cyclosporin, which lowered the immune system enough to stop the heart from being rejected, but not enough to be dangerous towards the patient.